Hello everyone, future nurses or anyone who interested in this topic. Today we are diving into the next big topic in our cardiology series, part 2, myocardial infarction and heart failure. We are going to cover everything from emergency diagnosis of heart attack to the ins and outs of managing heart failure. And stick around until the end because I will tell you how you can get a free PDF cheat sheet with all this info. By the way, perfect for your study session. Let's get into it. Alright, first up, myocardial infarction or heart failure. You need to know the two key diagnosis tools, ECG and cardiac enzymes. On the ECG, we are looking for ST elevation greater than 1 mm. This is a clear sign of ST elevation myocardial infarction, which means a major heart attack. Also, a new left bundle branch block can also be a sign. Here's our critical point. If there is ST elevation, a doctor can diagnose a myocardial infarction immediately. They don't have to wait for the blood test. Also, good thing to remember, Brugada syndrome can also cause ST elevation. It is a rare genetic condition that can lead to sudden cardiac death, so it is a classical distraction on the exam. Now, let's talk about cardiac enzymes. These confirm the diagnosis. Troponin is a gold standard. It is a protein released when the heart muscle is damaged. Another enzyme is creatine kinase myocardial band. In a suspected myocardial infarction, we test troponin level every 3 to 6 hours to track the damage. So, what is immediate response to a myocardial infarction? Remember the mnemonic, MONA-B. Sounds familiar, isn't it? Morphine for pain and anxiety. Oxygen, but only if oxygen saturation is below than 90%. Nitrates for vasodilation, and don't forget to monitor blood pressure. Aspirin, chewed immediately to stop platelets from clumping. Beta blockers to reduce the heart workload. After this initial stabilization, the doctor will decide on the definitive treatment like thrombolytics, which is a clot buster drugs, or even percutaneous coronary intervention, which is like an angioplasty, or even bypass surgery. Now, a very common complication after myocardial infarction is a heart failure. The damaged heart muscle just can't pump effective anymore. There are two main types. Left side heart failure. This is when blood back up to the lung. It causes pulmonary edema and disrupt gas exchange. Essentially, the lung start to flood. And right side heart failure. Here, blood back up into the systemic circulation. This leads to peripheral edema, ascites, and jugular vein distension or GVD. Let's break down the symptoms because the NCLEX allow to test this. For left side heart failure, think lungs. Dyspnea, especially when lying flat. There is orthopnea. Paroxysmal nocturnal dyspnea. It's a condition when the patient waking up gasping for air. Also cough, crackles in the lungs, and on auscultation you might hear an S3 gallop sound, a sign of fluid overload. For right side heart failure, think body. Edema in the legs and feet, ascites, which is a fluid in the abdomen, jugular vein distension or GVD. You can see bulging vein on the neck, and hepatomegaly, enlarged liver. Of course, liver takes some fluid too. How do we diagnose heart failure? First, oxygen saturation, it will be low. Number 2. Ultrasound, echocardiogram, to check the ejection fraction. If an ejection fraction below 40%, it indicates systolic heart failure. Number 3. Muga scan, a very accurate nuclear medical test. Number 4. BNP test, or B-type natriuretic peptide. This is the best blood test for diagnosis. If BNP more than 100, it is abnormal. If between 100 and 300, suggests possible heart failure. If between 300 and 600, it is mild heart failure. Between 600 and 900, it is moderate, and over 900 indicates severe heart failure. Now, the treatments. A lot of this revolves around medications. First line for acute heart failure are diuretics. We need to get that excess fluid off. First loop diuretics like furosemide, Lasix. With furosemide, you're supposed to watch for hypokalemia, and remember, IV push must be slow to avoid ototoxicity. Second, thiazide diuretics like hydrochlorothiazide. They can raise blood glucose, cholesterol, and uric acid, which can trigger gout. Also, potassium-sparing diuretics like spironolactone. Their big risk is hyperkalemia. And other key heart failure medication like ACE inhibitors like captopril to reduce afterload and protect the heart, statins for cholesterol control, and also anticoagulants, antiplatelets, to prevent clots from forming on the damaged heart tissue. A major complication we have to manage is pulmonary edema. A classic sign is the patient coughing up pink, frothy sputum. We treat this with morphine, nitrates, and diuretics. And finally, with a damaged heart, arrhythmia are common. Here is a quick rundown of the drugs. Beta blockers and calcium channel blockers are common first choices. Next is amiodarone, is powerful antiarrhythmic, but it has serious side effects like pulmonary toxicity, liver damage, blue skin discoloration, and thyroid problems. Not so little, is it? Lidocaine is used, but with caution due to sinus effect. Next is quinidine. It's pretty toxic. It can sometimes worsen arrhythmias, which sound paradoxically. Also, we know procainamide, which can cause a lupus-like syndrome. And finally, for now, adenosine. Remember, for supraventricular tachycardia, it is given by a fast IV push. So, don't forget, furosemide, slow IV push, adenosine, fast IV push. And that is wrap on myocardial infarction and heart failure. We covered diagnosis, the MONA-B protocol, the types of heart failure, key medication, and arrhythmia management. Now, as promised, I have condensed all this information into a clear, well-organized PDF cheat sheet. It is perfect for quick review before your exam or clinicals. Let's make a deal. Since I'm new on YouTube, if this video gets 10 likes, I'll add a download link in the description. Let me know in the comments which drug side effect do you find the hardest to remember. If this video helped you, please give me the thumbs up and subscribe for more NCLEX reviews. Next up, we will be taking endocarditis, myocarditis, and pericarditis in more details. Thanks for watching and happy studying!